بسم الله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. I'm Dr. Tariq Madani, Professor of Medicine and Infectious Diseases and Chairman of the Infection Control and Environmental Health Unit. I'll just explain what we mean by donning and doffing. Donning is wearing PPEs and doffing is removing the PPE. And actually doffing, removal of the PPE, can be more dangerous than the exposure itself, because when you remove the personal protective equipment, you may actually contaminate your hands if you don't do it properly, and you actually can get infected if you don't remove your PPEs properly. So it's extremely important to know when to remove the PPE and how to remove the PPE. Usually when we wear the PPE or when we don the PPE, we start with wearing the gown. So we put the gown first, and then you put the mask next, and then if you need to put the face shield, then you put the face shield third, and then you wear the gloves fourth. Okay, so we start with the gown, then the mask, then the face shield, then we wear the gloves. This is the sequence of donning or wearing the PPE. Whereas the sequence of doffing, the principle of doffing is you remove the most contaminated part of the PPE first. So the first thing you remove is your gloves. You should remove your gloves first. And then you have to disinfect your hands. Between removal of each PPE, you have to disinfect your hands with the hand sanitizer or the alcohol, waterless hand rub. So after removing the gloves, you remove, if you're wearing goggles, then you remove the goggles. If you're wearing the face shield, then you remove the face shield. Then you remove your gown, okay? And then you remove your mask. Then you remove your mask. If it is a surgical mask, then you can remove it inside the room. But if it is an N95 mask for an airborne infection, you should not remove the mask until you leave the room. You have to leave the room before you remove the N95 mask. But the surgical mask can be removed inside the room, whereas the N95 mask should only be removed after leaving the room, because we use this one for airborne infections. So if you remove it inside the room, you can actually get the infection by the airborne route. So you have to wait until you leave the room, and then you remove your N95 mask. So this is the sequence of removal of the PPEs.